Beating cancer has been a top priority for the EPP Group in the European Parliament, starting with the Cancer Masterplan in 2019, which contributed to today's unveiling of the EU Beating Cancer Plan. Today we'll discuss the next steps the EU should take to fight cancer. Good afternoon to everyone watching live on YouTube, Facebook and Twitter to our United Against Cancer event, coming to you from the European Parliament in Brussels today. My name is Jennifer Baker and I'm joined today by Cindy Franson, EPP Group Coordinator in the Special Committee on Beating Cancer. Finding the COVID vaccine was a success. Europe pulled together in extraordinary ways. But let's not stop there. Let's put the same grit, technique and resources into fighting cancer. That's our message today, and we'll examine what needs to be done, what is already happening and how we can achieve that goal. Today's event will be in 3 parts. On each of the panels we will hear from high-level speakers, followed by questions from you, the audience. So don't miss this opportunity to learn more. In just a moment, we'll hear from Manfred Weber, Chairman of the EPP Group in the European Parliament, to kickstart our discussions today. But first, let me hand over to my co-moderator, Cindy Franson.
Thanks, Jennifer. It's a pleasure for me to be here. And I just wanted to highlight the importance of the Beating Cancer Plan for our EPP Group. We have advocated for this for a long time. The message is clear. If we work together, we can make a real difference in people's lives. It's a very important day for us, so let's start.
Our first panel today is Fighting Cancer as a European Priority. As I mentioned, to give the opening speech is Manfred Weber, Chairman of the EPP Group, who pushed hard on the initiative to establish the Special Committee on Beating Cancer. He will be joined by Eric Abidal, former professional football player, cancer survivor and founder of the Abidal Foundation. Alexander Cheferin, President of the Union of European Football Association, and Margaritis Schinas, Vice President of the European Commission and the Commissioner for Promoting Our European Way of Life. But first, Mr. Weber, why does the EPP feel that fighting cancer should be one of the EU's top priorities?
Well, Jennifer, there I have one figure and one number in mind. That is 1.3 million. 1.3 million people died last year due to cancer. This is 3 times more than on COVID. And cancer has a potential to become really the #1 reason for death in Europe. And that's why we are picking this up as a top priority for us in politics in European level. 1.3 million is not a figure. It's about individual stories. It's about families, about victims, about fear, about anger, about frustration, about desperation. My personal story is that my brother died due to skin cancer. It's my story, my parents, my family. And I learned so much about this in the last decade. And whenever I discussed these issues, this cancer questions with doctors, with researchers, in my political responsibility with experts, then I always got the story, we can do more, we can achieve better results. The European Union is too uncoordinated in today's fight against cancer. And we are heavily divided. In the European Union of the new member state, in the east of Europe, you have 30% less chance to be detected as a cancer patient than in the west. So all these arguments motivated us then as EPP to start our road, our trip towards a better coordinated approach in fight against cancer. And our answer was, let's be more ambitious. I had the honor in the last European elections to be the lead candidate of our party. I was nominated in Helsinki, and in my nomination speech, I mentioned also cancer as one of the campaign issues. And frankly speaking, I was not 100% sure how the reactions would be, and I was I was surprised. I was, in a way, also overwhelmed by the support I got. And I have in mind that I started my campaign in Cyprus. Stella Kyriakides, our today's health commissioner, is also from Cyprus. That's why it's an interesting connection to this. I started the debate and the campaign there, and I mentioned cancer as one of the campaign issues. And one of the participants said to me, oh, this is not a too small issue in a way, because we have so much big international issues on the table. And my answer was, no, it is not the wrong issue, because it's not technical, it's not abstract for people, it's close to people, it's close to the feelings of people, to the emotions. And that is what Europe should be, close to people. And the people can really count on an EPP which really contributes and delivers now on our campaign proposals. You can count on EPP, that is my main message. We have already managed one big step, that is the creation of a special committee in the European Parliament, where Cindy is a front runner, but also Bartosz Arlukovic and our friends, Eva Kopacz, for example. It's also Peter Liese, it's also Niklas Poulas from Cyprus. So a lot of colleagues who are really working on this field. The EPPs as a team, united and active. And today we are really happy with the second step, with the presentation of the cancer plan from the Commission, when Ursula von der Leyen promised to pick this up as a key priority. And now Stella presented the key items now for the next years. And that's why we are proud. And today's conference is about a first assessment, first to listen and then to make a first assessment of the outcome. And it's great to have the researchers next to us, to have civil society from the UEFA, for example, next to us as friends who are supporting us in our fight against cancer. So it is possible to beat cancer. It is possible to at least reduce the number of victims. And in a way, we together have a dream, and we are part of this dream, and we can only achieve it together. We can only achieve it if we are united, if we are Europeans, and we can, as Europeans, hopefully be proud to being the first continent to beat cancer. That is our dream.
Thank you very much, Mr. Weber. Indeed, it's all our dreams here today. It would be wonderful to see it come true. I was particularly struck by your comment that indeed more people die of cancer than have died from COVID. So thank you for those words. Cindy, I'm going to hand over to you now to introduce our next speaker, Margaritis Schinas. So take the floor.
Thank you, Jennifer. Commissioner Schinas, it's an honor to have you here with us. And I have a question. Why is it so important that Europe takes the lead in this? And can you tell us more about the Beating Cancer Plan?
Let me first start by saying that being in politics is mainly for doing good things. And there is no more noble, better thing to do in politics than being part of this initiative like the Beating Cancer Action Plan we're presenting today. And I feel personally very emotional, very proud for being part of this effort. And I share this feeling with Manfred Weber because I happened to campaign along him in the summer of 2019. And I know how much he was personally involved in this, how much he pioneered the whole initiative. And knowing him, I know how happy and proud he should feel today. Now, the question is, why should Europe have a role in this? Well, because numbers tell a story. Europe accounts for over a quarter of cancer patients in the world, and we only represent a bit less than 10% of the world population. We are losing people. There is a human tragedy, which is a European tragedy. And there is another figure that 40% of the cancers, or the European cancers, are attributable to prevention, lifestyle issues, not genetics. And yet, we collectively in Europe only invest 3% of our health budgets to these issues. So there is a compelling story, both at the human level, of how to make people's life better, but also there is a major compelling economic prerogative that compels us to act. And what we're doing today is what the EU is best at: setting an ambitious goal, many tangible targets, realistic deadlines, a lot of money, 4 billion euros from different instruments, innovation, and most importantly, bringing together all relative actors, all actors concerned in partnerships that can work together over time. We are constructing today the beginning of a path for hope to be able to win one day this disease.
Thank you very much, Commissioner, for these inspiring words. And we will now hear from Mr. Alexander Čeferin, the President of UEFA.
Yes, Cindy, thank you very much indeed. Alexander, I know UEFA has been strongly promoting a healthy lifestyle, and not just for professional footballers. So tell us why a healthy lifestyle, sport and diet can go together for everyone in helping to combat terrible diseases like cancer.
Thank you very much. I want to first thank Chairman Weber for inviting UEFA to participate here at today's event. In the last years, you have been an incredible driving force in making beating cancer a priority for Europe. And as president of UEFA, and I'm also chairman of the UEFA Foundation for Children, I assure you of our full support in this vital battle. It is also a pleasure to share this panel with Vice President Schinas. We both share a passion for how the European way of life and European football can combine to deliver results on major EU priorities. And for sure, beating cancer is one of them. Finally, let me please also say a very warm hello to someone who is a real hero and ambassador for European football, and that's Eric Abidal. Eric, you are an inspiration for all of us. You defeated cancer, and with your foundation, you do great work with children and young cancer patients, and we shouldn't forget that. There are actually three ways that I see that we can help, and I would like to highlight today. The first is helping to build effective teamwork at all levels, from the pan-European to the national and the local levels. The second is how we help to make active and healthy lifestyles, as you mentioned before, accessible for all people, from all backgrounds throughout all their lives. And the third is how we help bring hope and enjoyment even against the greatest challenges and in the hardest times. As you probably know, UEFA works in partnership with European and national public authorities, civil society and relevant stakeholders. So we are committed to be a leading example of how sports bodies promote positive change and public policy objectives. And I would like to give you a few insights and examples today about three areas that I just highlighted. So to beat cancer, we need to bring Europe together and work as a united team. And football, as you also probably know, has great experience in mobilizing people around pan-European public health campaigns. It's unbelievable how the reach and influence that football has from a communication perspective. It's unrivaled. And at UEFA, we therefore see it as our moral responsibility to use this power to serve public interest as well. So whether it is support the Green Deal, vaccination campaigns, fight against discrimination or beating cancer, UEFA and the European Union are teammates based on our shared European vision and values. We are united with you, we have to be united with you, and your campaigns are our campaigns. So the next point is the importance of healthy and active lifestyles. Margaritis, I know you remember this initiative from years ago, when the European Union and UEFA launched a joint campaign against obesity. Together with the World Heart Federation and the European Commission, we developed an app and book showing young people how to prepare the same healthy meals as some of their favorite football stars. And our aim was to encourage them to eat healthy and lead an active lifestyle. It is a great example of joint action and is in line with UEFA's long-standing partnership to the European Week of Sport and Get Active campaign. We must continue, I would say, to educate and empower our children to have active and healthy lifestyles and help people to maintain this throughout their lives. And I already know, we know that the Commission is working on this area, and I would underline that from our standpoint, the key matters are access and non-discrimination. Indeed, no one should be left behind, no one should be left out or let down. Everyone must have the right to sport, no matter of their age, race, gender, where they live, or their financial or social situation. And this is at the core of UEFA's mission. It is also at the heart of the health and equality unions that the European Union is seeking to build. And I want to finish my remarks on the topic of hope. When we are challenged, even in tragic and frightening moments, as we have seen with COVID-19, and as we know is the case for the people and families battling cancer, societies and individuals often find their most inspiring selves capable of preserving and spreading hope. And I must say that for me, it's a privilege to observe inspiring acts up and down the football community of those battling to beat cancer and in individual collective levels. Whether it is players like Eric, who work with foundations and projects, or it is community clubs and support organizations in local areas who help cancer patients and charities. You should be assured that football brings people together to build hope and to build solidarity. And let me come to the last closing point. I'm not here today to say unrealistic things that just sound nice or to offer loose promises and leave. Empty words will not help us to beat cancer. We need strong teamwork and concrete actions. I'm here today to make commitments with you on behalf of European football, as your teammate in beating cancer. And indeed, Vice President Schinas and I have agreed to make beating cancer alongside other public health priorities a priority under the new UEFA and European Commission partnership agreement that we are already working on. And Eric, we are asking you, I don't see you, but I know you're there, to act as our ambassador for this promise, to help us build teamwork, maintain active and healthy lifestyles, and to bring hope. Because by doing those things, Europe can and will beat cancer. I assure you that UEFA remains your committed friend and partner in this endeavor. Thanks again, and all the best and to all of you from UEFA.
Thank you very much. Of course, in football, you know all about teamwork. We'll hear now, as was mentioned, we're going to hear from Eric Abidal, former football player, cancer survivor and founder of the Abidal Foundation, which supports children with cancer. So I'll hand over, Cindy, now to you for your discussion with Eric.
Thank you, Jennifer. Bonjour, Monsieur Abidal.
Hello, Mr. Abidal. Thank you so much for being with us this afternoon. It's extremely important for us to have you as a part of this event today. A few questions that I'd like to ask you. For patients, it's extremely important to be able to tell their stories. What was your personal story, please? First and foremost, thank you. It's a pleasure to be a part of this conference. I'd like to really congratulate everyone who is a part of this project. Thank you to the president of UEFA, Mr. Seferin, for his words. And it would be an honor for me to be able to represent with UEFA this important cause that we are trying to advance in our foundation. In terms of my experience as a former footballer, it's always very challenging very difficult to be diagnosed with cancer. We do not really realize what it will mean until it happens to us. And the disease really has a leveling effect. We begin a battle, a real combat that causes us to think and rethink everything and to reorganize our priorities. We find ourselves in a hospital's department with other patients, and as you've said, solidarity is really the watchword of a hospital service. It's so important in terms of all of the social aspects. We are all in the same battle, and we try to share our experience with the other patients and work and try to offer each other support and strength to exit from a very difficult and challenging experience.
Okay, merci.
Thank you. What does cancer mean for you? It's true that the word cancer is a very complicated word to define and even to understand. When you receive a cancer diagnosis, you begin a combat and a battle and a daily life that is completely different from normal life. And I thought much about my family, about the future, about all of my dreams that would perhaps now not be able to be realized. And I think about all of those people that are afflicted by the disease and that have to experience that. And then all of the people that surround you during the battle, the doctors, those who are working in the laboratories, our friends and family who on a daily basis are there to support us and to make sure that they bring us the strength so that we can actually prevail.
Et en conclusion, est-ce que vous pouvez nous raconter quelque chose de votre...
By way of a conclusion, could you tell us something about your foundation, the Abidal Foundation? Yes, as I was saying, I got my cancer diagnosis in 2011, and in 2013, my wife and I decided to establish the Abidal Foundation, which has my name, and based on the experience that we had had personally, and we knew the illness very well, we tried to bring our knowledge, support to research, and psychological support to the patients and families. The families, of course, that are also suffering alongside the patients emotionally. When you lose a loved one, the after effects are extremely difficult to manage and to accept. So we try to support them, and we have collaboration with laboratories as well who are carrying out research. We know that research is extremely important for the current period, but also, of course, for the future. That's what we are doing to try to bring our own building block to the entire edifice so that we have progress for patients in the future so that they can have a better life.
Okay, merci beaucoup de partager.
Thank you very much for having shared your personal experience with us. It's an enormous thanks to you.
Okay, especially for those very personal comments as well. We are now going to take questions from our audience to the panel. Michaela from Romania via Instagram has said, maintaining a healthy weight might lower the risks of various types of cancer. How can we encourage people to make exercise a daily routine? I think perhaps, Mr. Ceferin, that would be a good question for you.
Yeah, thank you very much for the question. And it's a good question. I'm not an expert, but I know that doing sports, practicing sports helps everyone in preventing the diseases, and healthy lifestyle is crucial for all of us. I think it's very important to know that UEFA, European football, is not only about big contracts and about a lot of money. Our task is to invest the money, and we do that, 90% of it, to youth, to amateur football. We promote healthy lifestyles, and if our superstars promote healthy lifestyle, it's a very important thing because of the reach of themselves and football as a sport. So we have to promote healthy lifestyle. Football, and not just football, all sports is very important for health, not only in European Union, but in all the world. So it's a good question, and we have to do even more about it.
Thank you very much, and thank you to our audience member for the question. Cindy, we have got many MEPs watching today, so I'm going to hand over to you for the questions from our MEPs.
Jennifer, for the moment, we don't have any questions.
Oh, okay. Well, I guess that's probably because we're answering them so well with our great speakers. Perhaps we shall move on then to our next section. And I know we have a video to bump us off and to start it. Thank you very much for joining in our first panel. We have heard there why fighting cancer is a priority for the EU. And after those inspirational speakers, I don't think there can be any doubt that it needs to be a priority. Our next panel will focus on the next steps. We will have a keynote from the Health and Food Safety Commissioner, Stella Kyriakides, but we also have other great panellists to speak to you as well. And I want to remind you, the audience, we have time for questions during today's event, so please do send them in. Use the hashtag the EU Can Beat Cancer and also the hashtag EPP for cancer. We want to hear your questions. Now, we have on our panel, we have Dr Matti Aapro, MD, President of the European Cancer Organisation. We are very honoured, Dr Aapro, that you have joined us. Cindy, would you like to introduce the doctor?
Thank you, Dr. Aapro. The COVID pandemic has affected the life of cancer patients. Can you tell us what changed?
Thank you very much for having invited the European Cancer Organization that I represent here. We are 34 professional organizations. I wish we were, but we are 20 European patient societies. And I'd like first to say my thanks to Manfred Weber for all the work he has done. I had the privilege to working with him as he was campaigning and have continued since then with many members of the parliament, including EPP members. And of course, it's a great pleasure to work along with Stella Kyriakides, whom I have known for, she doesn't want me to say how many years. Our cancer patients have been affected, there's no doubt, by the corona pandemic. And this is mainly if we think of what affects the patients, the fact that Eric Abitbol so nicely said, the family, the friends are there to support. And during the pandemic, the patients very often were left alone. They could not see anyone because of the risk of this COVID. So therefore, besides all the issues of vaccination, screening, treatment, follow-up, research that have been impacted, this has been dramatic for our patients. There's no doubt that one of the serious setbacks that we have seen recently is, from all the data that has been pouring in, that there is a delay in diagnosis. And we know how important early diagnosis is. We have heard that the Beating Cancer Plan is going to put a very heavy weight on screening, and all of this has been put back. So we have to work in order to convince all citizens that they should participate in screening programs. They have been adapted to the reality of the COVID situation. The health services are there to help them. They should come to their GPs and other physicians if they have any symptoms, not only about cancer, but for many, many other diseases. So I think there's a lot that can be done. And certainly the Beating Cancer Plan has many areas in which we can already work a lot in spite of the COVID. And we can learn from these initiatives that have been ongoing of the HPV vaccination that I'm so happy to hear is going to be for boys and girls, looking at all HPV-related tumors. This is something that ECO suggested already 18 months ago, and we are delighted to see this, and we are not the only ones that have been pushing for this. So I think that with the Beating Cancer Plan, we can build for better lives in spite of the current epidemic. And of course, we are here to help everyone. And I would like to thank very much the members of the European Parliament, all of them, and especially EPP, for supporting us and assuring that the EU budget has been adapted. And we heard very nice figures earlier today on how much is going to be dedicated to the Beating Cancer Plan.
Thank you very much, Doctor. I think we were all inspired by those words, echoing indeed some of the comments we heard earlier from Mr. Ceferu about teamwork and working together. We're going to turn now to our second panellist, Dr. Zsuzsanna Jakab, Deputy Director General of the World Health Organization. Thank you very, very much for being with us here today. Tell us, Dr. Jakab, what are the main goals the World Health Organization has set for cancer worldwide, and what role can Europe play within that global stage to fight cancer?
First of all, let me thank very warmly to Manfred Weber, Chair of the EPP Group, for convening this event and also for this initiative. And I'd like to send also greetings to Margaritis Schinas, Vice President, and also Commissioner Kyriakides and Commissioner Gabriel, and to many of the other colleagues. Let me start on a personal note. It is a great pleasure and honor for me to be back to the European Parliament. I have great memories of the time that I spent with the European Parliament between 2005 and 2010 as the founding director of the European Centre for Disease Prevention and Control in Stockholm. And it was really a wonderful opportunity to work with the Parliament as the budgetary authority. This initiative today is really great, and we are looking forward from the WHO perspective to work very closely with the European institutions, and congratulations to this EU Can Beat the Cancer initiative. Fight against the NCDs has always been a priority for us, and we fully support the dream of Manfred Weber. Let me briefly come back to the issues that you raised and start very briefly to update on the current situation of cancer control in Europe and globally before I come to the global priorities. New data from WHO that were released in 2020 reveal that global cancer burden continues to increase, now responsible for 19 million cases and 10 million deaths per year. That is 1 out of every 5 deaths is due to cancer. A person living in Europe has nearly 1 in 2 chance of developing cancer over the lifetime. Simply stated, cancer is a disease that affects all of us. Our lives will be determined by the health choices we make today, the environment we live in, and our willingness to invest in a system that will provide cancer if and when ourselves or our families encounter this illness. And even in Europe, our ability to successfully complete treatment without financial hardship is determined by the country we live and our socioeconomic status. And this is not acceptable, ladies and gentlemen. The second issue I want to briefly touch upon is that during the current pandemic, we have been further exposed to vulnerability of our system. WHO surveys have found that more than half of the countries have experienced disruption in cancer services, and this number is increasing. Large percentages of cancer patients, up to 90% in some settings, are going undiagnosed or experience delays. Interruptions in therapy or abandonment is becoming all too common. The consequence is millions of cancer patients being negatively impacted by the pandemic. This is the difficult reality of global cancer control. So the third question that you have raised, moderator, is what are the main goals that WHO has set for cancer globally? At WHO, we are committed to enable governments reach cancer targets that they have declared at the World Health Assembly and the UN high-level meetings. Cancer has been elevated as a global public health priority, now embedded in the UN Agenda for Sustainable Development. First, to reduce the premature mortality from NCDs, including cancer, by 1/3, and second, to achieve universal health coverage. To date, the progress is insufficient. Programs to reduce risk factors must be fully implemented. Tobacco still contributes to more than 25% of deaths in the region, and I have not yet addressed the air pollution issues or the obesity issues. Second, we must accelerate strategic investment in cancer towards universal health coverage. By investing approximately $4 per capita per year, we can save more than 7 million lives by 2030. 7 million lives. This will double economic gains in productivity and have a social value 9 times greater than the initial investment. Finally, we now have 3 global initiatives in cervix, cervical cancer, childhood cancer, and breast cancers to achieve targets and to make investments a reality. In November 2020, we launched a global strategy to accelerate elimination of cervical cancer as a public health problem. This is our first and only opportunity to eliminate a cancer and to save 4.5 million of lives by doing this. For childhood cancer, we strive to improve survival to at least 60% for all children around the world. We are working in more than 30 countries and improving survival and quality of life for their children with cancer. Finally, in 1 month, we will be launching an initiative to reduce breast cancer death. Core elements for scaling up capacity in diagnosis, treatment, and palliative care are common across 3 index cancer groups and can support achievement of broader cancer prevention and control programs. So finally, what can Europe do? There are 3 opportunities to highlight. First, Europe can spearhead global leadership, consolidate political will, and activate the cancer agenda. This can include signing up to eliminate cervical cancer and help countries reach this target. Similarly, support children with cancer globally by showcasing and building on your existing successful partnerships. Second, let's work together to address major deficits in workforce. Europe has some of the most advanced cancer centers in the world. Please share your expertise to strengthen healthcare globally and make the world a safe and more equitable place. So from a WHO perspective, we are looking forward to working with you in research, in sharing data, in betterment cancer patients' treatment globally, and we see the foundation for this in the commitment in this EC Beating Cancer Plan and the EU Horizon Europe 2020 initiative, and WHO is fully supportive to the EU initiatives in this. Thank you very much, and back to you, moderator.
Thank you very much, Dr. Jacob, and Dr. Aapro as well. Don't go away, as I know you have comments, and we certainly have questions to you from our audience. But we will turn now to the keynote comments from the Health and Food Safety Commissioner, Stella Kyriakides. Commissioner, it's wonderful to see you. Thank you very much for being here at this busy time. We are all very eager to hear about the EU Cancer Plan. It's something I know the EPP has been considering a priority for some time. So what are the next concrete steps for Europe, and how can we draw on the lessons learned from the COVID vaccine?
So thank you so much, and thank you for giving me the opportunity to be here on this really very special day of the presentation of the Europe's Beating Cancer Plan. Cancer has really been a part of my life for a long time. I was first diagnosed 24 years ago, and since then it became really, I realized then the amount of lack of information, the inequalities, the stigma and the fear that surrounded this disease. And that's when I became involved in cancer advocacy, and I see so many friends from the past, and we were still working together in partnership in this meeting today. And this is why it became very much a personal issue to try and work with everyone to make a difference. And sometimes in your political life, you'll find yourself given an opportunity. And this opportunity came from several directions at the same time. From the inspiration of Chairman Manfred Weber, who put this plan and doing something about cancer as a priority in his campaign. And I remember when he visited Cyprus, and he mentioned it too, and he spoke about this, and I was so terribly moved by hearing him speak, and I want to thank him and the EPP for really putting this on the agenda. But I never imagined at that time that I would have found myself in the position of being Commissioner for Health and Food Safety, and President von der Leyen putting this as a flagship priority in my mandate. And that's when I knew that we had an opportunity working together to make a difference for cancer in Europe. And we need to do this because there really is no time to waste, as many have said. We presented today a plan which has important and ambitious actions to beat cancer, because we want to change the world for cancer patients, their families across Europe, to have a concrete impact, but also for citizens, because we focus a great deal on prevention. The statistics speak for themselves. Europe numbers nearly 25% of the world cancer cases, while we are less than 10% of the world's population. And those are dramatic numbers anyway, in any way one sees it. And on the other hand, we know that 40% of all cancers are preventable. So we have a great scope of action. I wanted to share with you, as Health Commissioner, that in the last year now, almost a year since WHO called COVID-19 a pandemic, I have been in touch with medical associations, with stakeholders, and of course patient groups. And COVID has impacted a great deal on our lives, but it has really impacted on cancer patients' lives and their families. Diagnosis of new cancer patients dropped by 21% between March and June of 2020 compared to the previous year. And 34% of cancer patients reported a high level of psychological distress during the lockdown, and this is ongoing since then. So we can understand, and I can speak both as someone who has experience with cancer, but also as a clinical psychologist, how huge these impacts of this pandemic are. Today, we are mobilizing all the collective power and financial backing of the EU to drive change along the entire cancer pathway. We need to address the whole cancer pathway, from prevention to early detection to treatment to quality of life, of survivorship issues, of those living with metastatic disease, of different groups of patients, such as the elderly. And by doing this, we'll be maximizing the use of new technologies, of research and innovation in order to really deliver concrete benefits to patients. This is why in the plan that we presented today as a Commission, we have built in numerous indicators and targets. There are about 10 flagship areas and more than 70 individual initiatives and projects. Let me just touch on a few. We'll be launching a new knowledge center on cancer this year in order to coordinate scientific and technical initiatives and pool existing knowledge. We'll be working on prevention and, of course, looking at alcohol with an aim to have a tobacco-free generation where less than 5% uses tobacco as compared to 25% today. I heard Matti mention it, we're working towards vaccinating 90% of boys and girls in order to eliminate cervical cancers by 2030. We are going to put forward a new EU cancer screening scheme in order to give access to European citizens of state-of-the-art optimal screening by 2025 of the cancers that are offered by screening programs today. And we are setting a target of 90% of patients to have access to national cancer centers, so important so that they feel safe and in the best care that they're getting. I have really been shocked to see the number of waiting times in different member states, how it is your chance of early diagnosis and even your chance of survival is different across member states or where you live, and this cannot be the way that we deal with cancer within the EU. We need to address inequalities, and that's why we're establishing a cancer inequalities registry. And last but definitely not least, and I know that there are colleagues who have been personally touched by the area of children with cancer. I know my colleague from my country I know best, Lucas Furlas, is a strong advocate. I want to highlight the initiative that we have put in the plan on helping children with cancer. Children and adolescents need to have their specific needs addressed for detection, for treatment, their psychosocial needs. And for this, we're going to be building up this network of cancer centers. And for any plan to have any strong chance of success, it needs two things. One is funding, and this will have a strong financial arm. The Commission will make nearly 4 billion available over the coming years to tackle these challenges. And the other is implementation. So we have put together an implementation action group that will be following up the delivery of all the action plans as we go along. So today was a very important day because we put forward the Europe's Beating Cancer Plan. But as I always say, the journey starts now, because now we have to deliver, we have to implement. And today's a message of hope. Despite the fact that we're in a pandemic, this is a message of hope that together, all of us together, the member states, the European Parliament, the stakeholders, patient advocates, everyone together, we can make this a success. And I'm sure that I look forward to working with you in the coming weeks and months and years to see this actually materialize. Thank you so much for the opportunity.
Thank you very much, Commissioner, and stay with us as we will have questions for you from our audience. Now, and we first will go to a short video from Jan Geisler, who is a cancer patient and member of the European Cancer Organization's Patient Advisory Committee.
Hello, my name is Jan Geisler, a cancer patient for about 20 years and a patient advocate engaged with all stakeholders in health on the EU level. Cancer doesn't stop at country borders, and it doesn't stop during the pandemic. Especially the pandemic has shown how important a concerted approach on health in the EU is. The EU Cancer Plan, in alignment with the EU Cancer Mission, Horizon Europe, and essential EU health legislation like on clinical trials, data protection, and cross-border healthcare is so hugely important for us patients. Let's have a united approach working hand in hand with us patients and patient organizations to beat cancer across the European Union. Let's work together on the EU Cancer Plan and way beyond. It's all about us, the patients.
Food for thought there. Now, once again, we have questions from the audience. Thank you so much. Keep them coming using the hashtag #EUCanBeatCancer. Ana Perez from Valencia in Spain has a question to the Commissioner, asking, once the cancer plan is in place, how long will it be before people start seeing real changes? Commissioner, I think that one's for you.
Well, thank you. This is a plan that we announced today, but it is going to be rolling out over the next, of course, few years, and it has targets in it. So we have actually put targets in it so that we are able to assess how far we have moved. For example, we have put a flagship initiative to launch a European Cancer Imaging Centre, and this is to bring together all the new technology, computer tools to improve personalized medicine and innovative solutions, and this will be in place by 2022. Or the Knowledge Center on Cancer to bring together the scientific knowledge by 2021. So we are putting in flagship initiatives, but they also have dates to them so that we can also follow up the implementation and, of course, be accountable. Thank you.
Thank you. Christina from Landshut also asks, what can we learn from COVID for curing cancer? Is there any silver lining, Commissioner?
Well, from COVID, we're still learning from COVID. So one of the lessons I think that we've learned from COVID is how we need to have the right structures in place so that all patients and vulnerable groups, and not only cancer patients, are able to access their services despite a pandemic. So this is one lesson learned. I think that we need to be much more prepared in health systems to be able to cope with a situation like this pandemic, and for others not to also have access to their diagnosis and treatment. And what we also have learned, and this is the huge silver lining, is how quickly science can deliver good results. We have a vaccine now, less than a year after the efforts of all the scientific community with the support and the funding of the European Commission. We have now in Europe 3 safe and effective vaccines approved, and more on the way. So this shows how using science, using innovation and technology, we can make a real difference to people's lives.
Thank you. Dr. Jacob, now we have a question from Laura in Bologna to you, asking, what is the most important thing for helping children with cancer?
Well, first of all, learning from the COVID experience, it's very important to restart the disrupted programs in the field of cancer control. That is the first one that I would like to highlight. The second one is that in the countries where we have initiated the Children Cancer Initiative, we have to make sure that cancer services are available, hospitals and services are in place, workforce is in place, and products and legislation are in place. These are the 4 issues that we have put forward in our children cancer control initiatives. But we have also learned from the COVID that we have to ensure that the workforce that is reprofiled to address emergencies like during the COVID can also continue to cover the cancer control and the critical essential services that are there for children and also for the adults. And there is one more issue that we have learned from the COVID experience, and that is that the Commissioner already alluded to, that we have to look at the health systems and we have to see how we can make the health systems more resilient post-COVID, how we can strengthen the primary healthcare services, the essential public health functions, how we can invest more into the prevention activities, and how we can strengthen our activities in relation to preparedness for emergencies. Back to you.
Dr Aapro, now we want to hear your thoughts, as well as perhaps the answer to the question from Pieter from Gdansk, who's asked, when do you think we will have a European Health Union?
Well, this is a question that I would like to say tomorrow. Obviously, I'm not in the gremium that decides where we go, but I heard loud and clear when Ursula von der Leyen called for this European Health Union. And certainly the European Cancer Organization has been pushing for more coordination, maybe not the union, but more coordination, because it is only by coordinating the fabulous efforts that are done in every single European country that we will gain, because together we will multiply the efforts of the single countries.
Thank you very much for that. We have, of course, more questions for our Commissioner. We have one just come in asking, are there pan-European guidelines and policies under consideration for cancer prevention EU, especially lifestyle-related and preventable cancers?
Yes, there are, of course, and I'm sure that Matti can pick this up after me. There are, of course, guidelines, and there need to be guidelines in order to have best practice. There are EU guidelines for screening programs, and in the cancer plan we presented today, because this is very important, we are putting forward the need to have an update and of all the guidelines to do with screening, to have accredited screening programs, and these to be across member states. And because I think it's important that we say this, through the EU for Health, we will be supporting member states to be able to achieve the targets that we put in our program. For example, through the training of and specialization of the healthcare professionals if needed. So we are really looking at partnerships and working together. Thank you.
Thank you. Dr Aapro, did you want to comment on that question as well, about lifestyle and preventable cancers?
Yes, thank you. Thank you very much, Stella, for having alluded to the fact that, yes, both the professional organizations and the patient groups have put together several types of, I would call, guidance. One of them is the essential requirements for quality cancer care that has been led by the European Cancer Organization, along with its patient advisory committee. What is important, and I think we alluded to this earlier, or was it during your presentation right after the meeting this morning, is the fact that the knowledge of the population, of the existing, of the patient rights, of what the patient can ask for is insufficient. And this is something that we really have to put forward, because the work has been done, has been translated in many languages, maybe not all European languages, but almost all of them. But we need the power of the communication. And it was wonderful to have with us UFA, because they are one example of how we can communicate in order to have people listening to us.
Thank you very much. And now this is our last audience question that I think is for the Commission, really. It's come in from YouTube. Mike Morrissey, the CEO of the European Cancer Organisation, wants to know how the Commission can influence member states to deliver the target of vaccinating 90% of boys and girls to eliminate HPV. What is the role of the Commissioner in pushing member states to this target?
Well, first of all, we'll be working with member states in order to get there, and we can support them through EU for Health, investing in the infrastructures, helping them through joint procurements for vaccines. So there's a great deal that we can do working with member states in order to achieve this. And this is one of the targets that we have placed, that we will get there. It's a flagship initiative by 2030. Thank you.
Thank you. Cindy, I believe we also have questions from our MEPs who are tuned in.
Thanks again, Jennifer. Yes, we do. And dear colleagues, may I ask you to say who you are and to whom your question is directed? And we have a first one a member of the parliament, Mr. Busoy, who wants to take the floor.
Thank you so much, and really great thanks and a lot of appreciation for today's event. Thank you to Chairman Weber, and of course thank you to EPP Group for organizing this. Currently, we are facing policy gaps between the member states. Many member states did not updated their national cancer control plans in the last 5 years, and only 90% of the member states do not have a national cancer control plan at all. Of course, there are inequalities present both within and between EU countries, and here the patients are suffering. So we need to reduce this fragmentation. We need to make sure that everyone will update or will create a real national cancer control plan. And here I would like to ask the European Commission and Commissioner Kyriakides, which is doing an extraordinary job, not only in the area of vaccines, but also fighting against cancer. And as President of Industry, Research and Energy Committee, and also as the chair of the Challenge Cancer Intergroup in the European Parliament, I will support totally her and her team for all the measures and initiatives that they are taking. And the second very short question and intervention is the fact that when we discuss the new health program, and I'm the rapporteur on behalf of the European Parliament, we paid special attention to cancer and with a special focus on pediatric cancer and palliative care. And here the cancer registries are extremely important, and pediatric cancer registries are key in order to treat better the young patients from all over Europe. So here also we need the support of the European Commission to put some pressure on member states in order to create the cancer registries and especially pediatric cancer registries. Thank you so much.
Thank you, Mr. Busoy. I think so. We'll go first to the Commissioner to respond to that question on how the Commission is trying to stop this fragmentation that may be a problem.
First of all, thank you to Christian, and thank you for his amazing commitment in this area. He's absolutely right, and this is what the cancer plan, the Europe's Beating Cancer Plan, is addressing. The fact that there is fragmentation, the fact that we need to work together, and the only way we can implement this plan is, as I said, by working with member states, working with the European Parliament, and working with stakeholders in order to achieve the targets. And we will be using all the available funding instruments with, as I said, a total of 4 billion for actions addressing cancer, and this include actions that we will be supporting member states in order to achieve cancer registries, and you're absolutely right, and national cancer plans, which are absolutely essential.
Thank you. I think we'll take the second part of that question to Dr. Jacob on cancer registries, particularly pediatric cancers.
Yeah, I fully agree that cancer registries are key, both for adult cancer patients and also for children. And there is a long way to go until we can say that cancer registries are well covered and well in place, and they are up to the level as they should be. So there is no discussion on this. We have to go further and improve them. And we have to work very closely with the European Commission on this, so that what Commission is doing, what WHO is doing, is fully aligned. But I'm very pleased to listen to the Commissioner, because I can see that in the targets that the Commission has set in this strategy are fully aligned with the targets that WHO has set for its global strategies. Like, for example, this 90% of vaccination coverage for HPV for the patients up to 2030. That is a WHO target as well, like 70% screening or 90% access to treatment and palliative care up to 2030 as part of the SDG development. And this is important that we work in partnership and all these targets are aligned, because then when we roll out these cancer plans to the country level, like the Commission is doing now, and WHO member states are also in the process in different stages of development, development, then our activities can multiply each other, and the Commission and WHO are key partners to each other. There is one more issue that I'd like to highlight in this regard, and that is that we have done a lot for the risk factors and for the prevention side, but not enough. We really need a paradigm shift towards prevention, to invest much more into prevention than in the care. And looking at the healthcare expenditure, even in the most developed European countries, you see that around 90-95% of the healthcare expenditure goes into care, which is very important also, but not enough goes into public health and into prevention. And this is also one of the lessons we have learned during the COVID now. Back to you, moderator.
Thank you very much. Cindy, I'm going to hand back to you as our liaison with the MEPs.
Thank you. We have a second question from our EPP colleagues, Tomislav Sokol. The floor is yours.
Thank you, Cindy, very much. I'm Tomislav Sokol, MEP from Croatia, member of the Special Committee on Beating Cancer of the European Parliament. So first I would like to congratulate Commissioner Kyriakides for all the work that she has done, and I would just like to say that publication of this Europe Beating Cancer Plan is a big victory for her and for the European Commission and for the EPP, whose initiative was to make this plan from the start. What is the added value of this plan? I believe that it is more, that the crucial thing is its holistic approach, so that it really does not focus only on health treatment, which is the stereotypical approach, but that it covers everything. So from prevention, early detection, research, healthcare treatment, and care for the survivor. For instance, the aftercare and the question of how they live their lives in the future, access to financial services, so all of these very important things. I also like the fact that the network of comprehensive cancer centers in each member state will be established. I think this is very important to achieve equality and equal access to healthcare across the European Union. And I also like a specific mention in the plan of priority funding for healthcare facilities with the public service mission, because EU funds, EU budget, apart from EU for Health program, but also the cohesion policy funds, is a major source of financing into healthcare infrastructure, especially in less developed member states. And it is very important that these resources are streamlined to invest into healthcare facilities where they are needed the most. So I have two short questions. So first is about equality of access. It's mentioned in the plan, and it was mentioned by the speakers, that the differences in terms of access to healthcare also result in different health outcomes across the European Union. And there is a much bigger chance of surviving cancer if you live in, let's say, in some member states in the western part of the EU than in some member states of the eastern part of the EU. So this is something which is completely unacceptable, and we should fight this, and this is where the European Union should put its priority on. One of the reasons for this different access and different quality of treatment is the access to cancer drugs, cancer medicines, because we know that the different member states have different possibilities to pay for very expensive cancer drugs, cancer medicines, and of course and it is the fact that the prices of cancer medicines are not the same across the EU. So my question is whether this approach of having common procurement for vaccines, common European procurement for vaccines, with the result of reducing prices and making it possible for all member states to have equal access to vaccines, can also be transferred and expanded to expensive cancer medicines. This will be especially beneficial for those member states with less financial possibilities and weaker negotiating position in pharmaceutical companies to achieve better price. We know that there are problems now with vaccines, but they are being resolved. But I think in the future, if we want really equal access to expensive cancer medicines, this kind of common procurement, public procurement on the level of the EU is essential. And my second question is about tobacco taxation. The plan mentions the tobacco taxation directive should be amended, that taxation of tobacco should be much stricter than it is today. But we know that according to Article 113 of the European Treaty on Functioning of the European Union, unanimity of member states is required. So my question is whether do you think that you will be able to get all of the member states on board to agree to this change in taxation? Because I know that there are different approaches in the different member states, and I believe that there will be a lot of resistance related to this. And also related to this question is that the plan has also expands this harder and stricter taxation also to e-cigarettes and other types of alternatives to smoking and alternatives to alcohol, etc. So my question is, of course, this is the approach taken, but do you think that maybe in terms of harm reduction, a bit more research is needed to determine whether there may be some positive aspects of these harm reduction measures like e-cigarettes, something like that? So do we need more research on this, or do you believe that we have a scientific consensus that this is something that should be put in the same category as smoking itself? Thank you very much.
Thank you very much. So some complex questions there. So let's start with the equal access question. And Dr. Aapro, I know you have some thoughts on that.
Yeah, thank you for asking me to comment. The equal access, it's a question not only about access to drugs, it's a question of the whole structure in the various countries. In our vision, the issue is the diagnosis is made much too late in some European countries because screening is not effectively used in those countries, because access to the doctor who can think of cancer is not effective. So let's start by that. Then the quality of the radiation therapy system in some countries leads to delays because there are not enough machines for everyone in the country as per the definition of the WHO. And finally, we have also, and very importantly, an issue of specialized surgery. So it's not only about drugs. Drugs are certainly a problem, but there are many others.
Thank you. Commissioner, I want you to address this question of joint procurement as a possible solution to equal access.
Well, there's a number of questions that have been raised. First of all, I will say on the issue to do with the cancer plans of member states, of course, we don't control their plans, but we're going to be looking at them and how they are implementing, but we don't, in fact, control them. I think that is quite clear. What we will be doing also, because it was mentioned children's cancer, is creating a European cancer information system on children's cancer, which I think is going to have a lot of really added value in the area of pediatric cancer today. We are working on, we have already presented our new pharmaceutical strategy in November. This will also it is looking at issues to do with accessibility and affordability of medicines. And of course, this is not only for cancer medicines, but the implementation of this strategy and changing the realities of affordability and access of medicines, of course, will also benefit the area of oncology. And finally, on tobacco, it's a fact that it is one of the leading causes of preventive cancers, and we do hope that member states will follow our lead on this. As to what was mentioned on the alternatives of e-cigarettes, etc., we are still looking at the science, and we will come forward with a proposal once the science has been assessed.
Thank you. And let me turn, Dr. Jakob, I'm sure the World Health Organization has strong opinions on equal access.
Especially on equity issues, yes, within the SDGs and also within our own strategic vision, equity is a key driver and a key issue. Of course, we are looking more broadly at the access issues globally between high-income and low-income countries, not only within the EU. And if you look at service capacity, what you see is that services, cancer services, are 3 times more available in the high-income countries than in the low-income countries. And looking at it from a workforce perspective, you will see that the difference is about 100 times. So workforce is really an issue. You have 1 to 300 cancer medical doctors or personnel in place in the high-income countries and 1 to 30,000 in the low-income countries. So this is a huge difference, and we have to tackle that. And overall, globally, there is an 18 million shortage of workforce, and this is a big issue. And the more we can work with the high-income countries to support the low-income countries, the better it is. With regard to the procurement, I mean, it's the commissioner who can advise on this, whether the EU countries would agree to have a joint procurement. But what we see is that the joint procurement definitely has to reduce the prices. And then with regard to tobacco taxation, it's a fact that this reduces the demand, so it is not up for discussion. And then we definitely need more research on the harm reduction issues.
Thank you very much. Thank you, Doctor. Thank you, Commissioner. Our expert, knowledgeable panellists, and thank you to you, the audience, and of course our MEPs for your probing questions. Now stay with us, as we will be having a third panel, and we know diseases like cancer take a heavy toll on our citizens, but let me throw some figures out. We have 3.5 million people in the EU diagnosed with cancer every year, and 1.3 million die from it. So do stay with us for our next discussion and keep those questions coming. As you might expect, our final panel today looks to the future and focuses on cancer research and care. Now, the EPP Group has championed the fight against cancer, and no one can promise we will cure cancer tomorrow or in how many years this will happen, but all big projects start with a vision. We have at our disposal in Europe great technology and innovation, so how can we use it in the fight against cancer? To start this section, we are very fortunately joined by Mariya Gabriel, the European Commissioner for Innovation, Research, Culture, Education and Youth. So we will be hearing from the Commissioner in just a moment about what we can do going ahead. But we are also joined by our other panellists, and I am going to hand over to Cindy to introduce them.
Yes, thank you, Jennifer. We are joined by Dr. Fernández, Chief Data Officer at the Curie Institute in Paris, and Dr. Ulrike Gnad-Vogt, Chief Medical Officer at CureVac. And my first question is to Dr. Fernández. How can big data and AI support the fight against cancer and the evolution towards more personalized medicine?
Good afternoon. Thank you for having me here. I'm delighted to talk about precision medicine. But first, as Dr. Aapro just mentioned, I would want to remind you that surgery and radiotherapy is the treatment that contributes most to cancer cures today. More than half of the patients across Europe would receive radiation oncology at some point in their disease. I have the privilege, as you just said, of being the Chief Data Officer of Insitut Curie, which would be considered the cradle of radiotherapy. And as we are now celebrating 100 years of the creation of the Fondation Curie, 100 years of generosity, we are still today inventing tomorrow's cancer treatments. It goes without saying that big data relies on data. Our medical teams gather lots of data when they are treating our patients. This data would be genomic information, medical imaging, medical notes, and this information guides them to make their therapeutic choices. Cancer today generates lots of data because, fortunately, it's becoming a chronic disease, and that translates into many visits to the hospital, and every visit produces data. Data is also critical because today we treat patients based on the information and in the information we have gathered from the past. We learn from past patients and we treat patients today. But we have to remember that our physicians, the priority of our physicians when they are in consultation with a patient, those 15, 20 minutes that they have with a patient, it's looking into how to better treat that patient, and they are not thinking in the future. And this is very important because when we go into, we want to say, what's precision medicine? Precision medicine or the use of molecular profiling technologies for tailoring the right therapeutic strategy for the right person at the right time is becoming today the standard of care in oncology. But to assess whether treatments work or don't work, we need up-to-date access to real-world evidence. We need reliable outcomes data. And this can only be achieved with the relevant infrastructures in place. And these are infrastructures which are built to handle large data sets in an interoperable way, so that we can link the molecular phenotypes with the potential to transform medicine. Insitut Curie, as a cancer institute at the forefront of cancer care, we are putting together DigiCore, Digital Institute for Cancer Outcome Research, which is a public-private partnership in the form of a new European Economic Interesting Group. The ambition of DigiCore is to become a cancer community to help us make every willing cancer patient a research patient to improve our healthcare systems. And when we are using the same precision medicine paradigm into other disease areas beyond oncology, we can, I can talk about the other dimension of Insitut Curie. Alongside a hospital group, we have a research center focused on fundamental research, and amongst many other projects, we are working in establishing a European initiative, Lifetime, which aims to develop interceptic medicine. I mean, in the past 2,000 years ago, physicians will look into the stars and read horoscopes to treat patients. 20 years ago, we started a digital pathway with the human sequencing of the human genome. Today, we are talking about precision medicine and knowledge networks. But tomorrow is intersection, and the intersection is this space where we can treat patients before the disease appears, or before the first symptoms of the disease appear. And the way we are posing this from a research point of view is based on 3 technologies: single-cell multidimensional data sets. That means we are zooming down into the individual cell type. We are zooming down into the interface between the tumor and the host. We are obviously exploiting and leveraging artificial intelligence and machine learning initiatives, and also we are developing patient-derived experimental disease models, organoids. And in this ambitious project, we have 90 European research institutes across the continent, and we are supported by over 70 companies. This is a project coordinated by Insitut Curie and the Max Delbruck Center for Molecular Medicine in Berlin. And this is the latest amongst a series of very ambitious initiatives in the genomics space. Can think of, in the last 15 years, the Cancer Genome Atlas, International Cancer Genome Consortium, which paved the way to new targeted treatments today. Treatments that, immunotherapies that we use today to treat melanoma and lung cancer come from these basic research experiments, which involve data from over 11,000 patients. But often these projects focus on the driver genes, which are found in less than 10% of the tumors. And the long tail, the long number of patients are not included in these patients. So that's why we carry on focusing on this, zooming down into this cellular level. Tomorrow we are celebrating the World Cancer Day. And this year, Curie, we are focusing on new treatments in our celebrations. And as cancer therapy is changing, cancer has gotten very complicated in a very short of time as we are going down at the molecular level. And as the first cancer center in France, we are working in various fronts, but always involving multidisciplinary teams.
Thank you very much, Doctor. I think we'll hear now from our fellow panelist, Dr. Gnad Voigt. A couple of specific questions for you, Doctor. So how does the technology of the vaccine work, and how can these advancements be applied to cancer?
Yeah, so hello, and thank you very much for inviting me. It's a big honor. Yeah, so yeah, happy to explain our technology. So at CureVac, we are using messenger RNA for vaccination, and messenger RNA is a carrier. It's kind of a recipe for a protein that we inject into the muscle, yeah, or the skin. And here cells are taking it up and can produce a protein that is encoded on the messenger RNA. Yeah, and the beauty of that technology is that it is so flexible. Yeah, you can write down whatever kind of protein or vaccine antigens. What has been now demonstrated with the speed, how fast COVID vaccines could be advanced to the market or in phase 3 trials as our own ones. And yeah, so that's how the vaccine technology works. I think now, based on all the learnings and successes with COVID, we may benefit for applications in cancer. Because over the year we have learned a lot how we can optimize messenger RNA, how we can optimize formulations, which is key, yeah, to formulate it in the right way, that the messenger RNA gets uptaken into the cells and can elicit a strong immune response. And now is really the time, and we are also actively doing this at CureVac to think about future applications for cancer. By the way, I mean, we started already in 2008 to work with messenger RNA vaccines. The company already was founded in 2000, yeah, by our founder Ingmar Hör, and over the years, when nobody believed in this technology, yeah, we gained already a lot of experience there. But the first clinical trials were conducted in cancer patients. But at that point in time, I think the field was not so mature. We had to learn on improvement on the vaccines. Also, not all combination therapies were available, like checkpoint inhibitors that could synergize nicely with the vaccine. So the world, let's say, has changed, and now I think it's also the time to bring mRNA vaccines to cancer patients again.
Thank you very much, Doctor. And of course, both of you will stay with us as we will have questions to you from our audience. But now, as I mentioned in this panel, we are joined by Mariya Gabriel, the European Commissioner for Innovation, Research, Culture, Education and Youth. Commissioner, I know that innovation is one of your key areas, so thank you very much for joining us today to talk about that. And I hope you will tell us how things like digital health and AI and so on can support the fight against cancer, and also what are the main areas within that you think Europe should invest in?
Thank you.
Great. Yes, we can hear you now and see you. Great, thank you.
Okay.
Great.
Thanks a lot, Jennifer. Apologizes. I just finished my press conference with the Ministers of Research. Yes, we continue to talk about our research innovation agenda, and of course the topic on how we are using research and innovation in order to tackle this burden, which is cancer in Europe, is crucial. So of course, maybe here I will stay focused on three main messages. First, of course, we need to think strategically and inclusive. That means that first we need to use all our instruments at our disposal in order to tackle this challenge. Of course, first we have the increased budget of Horizon Europe program. Remember, 30% of increase in comparison with the previous program. And this time our health cluster has been reinforced by the Next Generation EU funds, and we'll have a total budget of 8.2 billion. Second element, in the Horizon Europe program, we introduced the mission approach to leverage large-scale investments, mobilizing innovators, researchers, public authorities, and citizens. And one of our 5 main missions is the mission on cancer, with a very concrete objective: 3 million saved lives by 2030. The mission board presented 13 very concrete recommendations addressing 5 themes: understanding, prevention, treatment, survivorship, equitable access. And several of these recommendations already appear in the cancer plan. Actually, we are preparing the implementation plan for the missions, defining the first concrete actions and deliverables, and calls to support this exercise will be reflected in the first work program in 21-22. Third element, we need to use our partnerships. You know that it's a crucial element in our Horizon Europe program, and that's why new partnership in the strategic health areas will contribute to cancer research and innovation. 3 examples. A new partnership on personalized medicine will be launched in 2023. The Innovative Health Initiative will be proposed this year and will work in order to create the right ecosystem, bringing together health industries, researchers, and patients. And it will build on the success of the Innovative Medicine Initiative partnership, and now we need to go further. Third element, we need to use the capacities of our European Institute of Innovation and Technology, and especially the kick on health. Our support is very strong. Last week we finished just the negotiations with the European Parliament, and here I think that we should use the capacities of kick health in order to promote the collaboration between medical professionals, researchers, entrepreneurs, and patients. We also have to focus our efforts in key areas such as pediatric cancer, education, training, and prevention. And when we talk especially about our children, it's just not acceptable the actual numbers, because in 2020, 15,000 children and adolescents were diagnosed with cancer, with over 2,000 young patients losing their lives. And pediatric cancer is a rather unexploited area. So here I think that research at European level will provide a critical mass which cannot be reached by individual member states. And that's why pediatric cancer is one of the key priorities of the Horizon Europe Cluster Health and Cancer Mission. Of course, we need to use all our possibilities linked to education. I'm thinking here about our young researchers and Marie Skłodowska-Curie actions. I'm thinking about our European University alliances. There is not so much people that know that, for example, 11 out of 41 European University alliances, with a total of 55 million euros, will support education, research, and innovation actions contributing to the cancer priorities. Of course, we also need to step up our efforts for prevention. According to WHO, 40% of all cancers can be prevented with the adoption of healthy lifestyles with physical activity. That's why it's in our Cancer Action Plan. There will be a new initiative. I will launch the Healthy Lifestyle for All campaign this year, involving member states, regional and local governments, and civil society representatives to promote sport and physical activity. And of course, here we'll use all our sport projects and programs within the Erasmus Plus program, because actually we have invested 24 million euros to promote participation in sport in order really to promote sport for cancer patients. Second, important, very big important topic, data analysis and sharing. This is crucial. We need to improve data pooling, analysis, and sharing in line with data protection regulation and privacy. And that's why It will launch a new knowledge center on cancer before the summer. That will be done with Joint Research Center. And our ambition is really here to have a huge amount of data in order to already identify more clearly some of the threats and some of the best solutions. And we'll also launch the UNCAN.EU, a European initiative to understand cancer. The UNCAN.EU initiative will be the most ambitious RNI network to understand cancer. It will develop a platform of different data sets and using innovative models and technologies, mine these data to better understand how cancer initiate, develop, and spread in different individuals. We'll create a virtual digital patient center by 2023. That's one of the concrete recommendations of our mission. And of course, here we need to think how we'll use our European Open Science Cloud in order to support cancer research, allowing researchers to have access to analyze and process research data. Because we all know that this access is not equally distributed and not all our researchers have access to this. Finally, third message, in order to achieve this ambitious plan, we need to coordinate with all member states and regions. Member states already invested significantly in cancer research innovation, in infrastructure, but we should also build on these efforts and improve coordination. That's why we propose to create a European network of comprehensive cancer centers, building on the recommendations of the Cancer Mission Board. And the comprehensive centers are national or regional infrastructures focusing on cancer care research and training. And here we'll support member states to establish at least one national comprehensive cancer center by 2025. Final point, coordination with regions. We definitely need to involve our regions in this common work in order to be sure how complementarity, for example, with cohesion policy, how we can, together with regions, overcome existing inequalities in access to cancer research and knowledge can be done. And that's why I think here that it will be crucial to work more and more with the Committee of the Regions. And I think that we should use this opportunity in the framework of our joint action plan with the Committee of the Regions to see how we can better achieve results. Because above all, we are talking about our citizens, we are talking about our families, about our children, about us as a society and our future as Europe. Thank you very much.
Thank you very much, Commissioner. Indeed, it absolutely touches us all. Cindy, over to you again. Do we have questions from our MEPs?
Yes, we do. Colleagues, again, I want to ask to say who you are and to whom your question is directed. I have a question from our EPP colleague, Sean Kelly. Sean, the floor is yours.
Thank you very much, ladies, and well done to everybody, and particularly our Chairman, Manfred Weber, who has been pushing this all during this mandate. My question is for my good friend, Commissioner Mariya. Mariya, and it relates to cervical cancer. It is one of the most preventable and curable forms of cancer, but it still kills many women every year in the European Union. The WHO believes it could be eliminated worldwide within a generation if the right steps were taken. But what steps are we taking in the EU to eliminate cervical cancer, and could we actually eliminate it by the end of this mandate? Because if it's preventable, it's a question of doing it. We don't need any inventions. Thank you very much.
Thanks, Sean, for the question. Commissioner Gabriel, would you like to rise to that challenging question about eradicating cervical cancer?
Well, I think that it's our common responsibility to do our best in order to achieve the best results. Now, what is clear is that for the first time, this topic is so high in our European agenda. We have now a real plan where we can build synergies between what we are doing in research and innovation, what Commissioner Kyriakides is doing with member states, and the EU for Health program. So I think that what will be extremely important is first, very clearly to see what is achievable this year in order to have a strong base. And I fully agree that prevention is the key point. We all know that there is a lot of cases, different forms of cancer that can be prevented. And that's why, for me, the main challenge now is what is our common base of data, how we can use the best practices that already exist in our member states. And that's why we need access to data, we need coordination, and we need synergies in order really to help all the member states to prevent this and to do it for their citizens. Because, to be very honest, not all member states have the same resources to act. But this time, with this action plan and with the contribution that we can have from Erasmus, from Horizon Europe, from our researchers, from our startups, because they are everywhere, and the close cooperation with member states and regions, at least what I'm convinced that it's this time to win this, at least partly this battle.
Thank you. Cindy, back to you.
Yes, we have a second question from our colleague Eva Kopacz. Eva, the floor is yours.
Dziękuję bardzo. Ja mam pytanie do pani Gabrieli, Marii Gabriel. Pytanie dotyczące...
Thank you very much indeed. Thank you very much. Let me start with a general point about what I'm hoping for. We're right in the middle of a pandemic and a lot of people in a very difficult situation, in particular cancer patients. Many die every year. New information on new treatment methods are of great interest, but what is most important and what gives us hope is what can be done in specific terms. During a pandemic, we've heard about new vaccinations against the coronavirus, mRNA vaccinations. There have been improvements with respect to RNA, and that could be used for cancer as well. Now, of course, we need financial resources to support this kind of research, but how quickly would it be possible to ascertain whether or not this research can lead to success? Is it a short-term plan, or do we have to wait much longer?
Thank you very much for your question. So I think we will turn over to Commissioner Gabriel to tackle that one.
Thank you. Thank you very much, Eva, for your question. Well, here I must share that when that was my first meeting with Ugur Sahin from BioNTech, one of the main reasons that I believe so strongly in them, it was exactly because he worked on mRNA for the last 20 years. And because there is a huge perspective that what we discovered now with the vaccine can be extremely useful for cancer, especially because this time we are not talking about cancer in general. When we stay focused on this work, for example, of the team of Ugur Sahin, we are talking about 5 forms of cancer, and we know that there is more than 200. So actually what I believe is that we need to use this time and the advancement that these teams of researchers have shown to us during the last 1 year in order to speed up and to accelerate and to stay very, very focused on this. That's why I'm very happy that first support was already provided to this work. Allow me to remind you that Ugur Sahin was one of our grantees with the European Research Council in 2008, especially on this work, mRNA linked to cancer. And that's why what is important now, as he already said it too, we need partnerships, we need ecosystem. What we have seen during this crisis is that we have brilliant researchers. It's important to continue to invest strategically in this research. It's important to build ecosystems in order to mobilize all those that can contribute and to allow access to data in order to scale up and to achieve critical mass. And that's our chances really to advance more rapidly. So yes, we'll stay very mobilized on this and we'll continue to follow this very, very closely. I fully believe that with Horizon Europe program and with the new possibilities that we have with the new program, we have more chances this time for better results. And again, we are talking here about very concrete achievements, but I stay very confident.
Thank you. And Dr. Fernández, I believe you also wanted to respond to that question with your comments and thoughts.
Yes, if I may, as Commissioner Gabriel just mentioned, when we talk about cancer, we simplify things. We are talking about over 200 diseases, very different. We often talk about lung cancer, or we talk about breast cancer. Even within lung cancer, we can identify, when we zoom down at the molecular level, a diversity of diseases which are treated very differently, and that's why I was evoking at, or was implying before when I was talking about zooming down at the molecular level. We can better understand the cancer and we can translate that into a treatment. But obviously, this fundamental research takes time to be translated into treatments. Even when every time a new treatment is approved, we can see that the life of our patients is improved because we are months or years on the survival figures. We also are aware that there is a timing issue. When we are focusing on research projects like Horizon 2020 right now, or the future Horizon Europe, we are talking about normally funding streams, which are talking about a 3 to 5 year cycle. Transforming cancer takes longer. From a proof of concept, if we are talking about one of these very innovative approaches using artificial intelligence, which enable to better stratify, to better identify the possible outcomes of a patient. Best case scenario from proof of concept, early results, scaling up, clinical trial, getting the green light for the national agencies. We are talking about 10 years for a revolutionary approach. So we have to take into account that if we want to transform, the timings are different. It takes longer.
Thank you very much. We're going to turn now to questions from our audience. And Eric from Sweden has asked via Instagram, Dr. Fernández, to you, in fact. He's asked, how do we make sure that every EU country cancer survivors don't get into trouble with insurance companies? How do we guarantee that every former patient has the right to be forgotten? Dr. Fernández, I think you might be able to tackle that one.
Yes. Can you hear me now?
Yes.
Okay. Yes. I'm right now, as I've mentioned at the beginning, I'm living in France, and France is one of the first countries where this right to be forgotten has been implemented, has been put into law. And this is one of the aspects that a few months ago, when I was discussing, with Manfred Weber about possible ideas, brainstorming about ways of fighting cancer. This is one of the initiatives which I found very interesting in France, because it means that a cancer survivor, I used to live in the UK. If you are a cancer survivor, you will not get a mortgage. Because insurance, you won't find insurance, banks won't give you money because of the risks. That's after 5 years, I believe, is in France, that record disappears and there is no possibility of discrimination. So that, I think, is a good model, 5 years or reducing it, but that should be the standard across Europe, definitely.
Thank you. We also have a question from Peter in Dublin to Gnad Voigt. Dr. Gnad Voigt, how is it possible that a new medicine against cancer can work? How can we be sure that it is safe?
That is a very good question. So I think with regard to mRNA, We learn now, of course, a lot from the COVID program and from prophylactic vaccine program, where we will treat many subjects. So far, of course, all these treatments are evaluated in clinical studies, and for mRNA, the safety record in the trials conducted by us and by others was always very good. So we had no hints, for particular side effects. Actually, we see these treatments are quite well tolerated and can be combined also with other cancer treatments without resulting in a major increase in side effects.
Thank you. We have a final question now just to Commissioner Gabriel, as time is running short. But Ramona Blaga has asked a very specific question. Might the EU fund an EU institute and advanced research studies for early detection of tumours amongst EU patients, presumably within the next EU financial framework?
Well, thank you very much for this question. I think that first we should use what already exists. And here I would like to mention a very concrete topic. Is our EU Topia project, which evaluated the harms and benefits of population-based screening programs for breast, cervical and colorectal cancer in all of Europe. And once fully implemented by member states screening programs, these results could reduce the difference in the cancer burden across Europe. So definitely my question is, yes, we need these kind of projects because we need all the data in all our member states in order after to address it in a very concrete manner, the reality on the ground, but this time with something different, with more coordinated actions and with common framework. So I think that that will be a very, very, very good challenge to all of us, but this time we have the instruments to do it rapidly and to do it in a profitable for everyone manner.
Thank you very much, Commissioner, and thank you, doctors. Keep up the great work. I think also you had some very useful comments for our audience. And I hope that over the course of this afternoon, everyone has seen the importance of keeping a focus on cancer. The EU Cancer Plan is certainly ambitious and there's certainly much to be done, but let us not be derailed by the pandemic. I want to turn finally now to Dr Peter Leese, MEP, the EPP Group Coordinator for Environment, Public Health and Food Safety, to draw together all of the threads of today's conversation and give us a vision for moving forward.
Yes, thank you very much for giving me this opportunity. Thank you to the EPP Group, to Manfred Weber and to everybody who contributed today. I think it was a great event. And I have three main messages to take away. And this is, first of all, the question, why do we in the European Union need to act on cancer? And I think it's very clear the European Union alone cannot beat cancer. We have responsibilities of the member states, of the regions, but without European cooperation, we will not make it. And we will definitely not make it in rare cancers. We will not make it in personalized medicine, of one of the last speakers mentioned. We have many subgroups, even in the big cancers. You can treat them differently, more targeted, more efficiently. That means you have less patients in one member state, so cooperation will be beneficial. And it's definitely true for what is closest to my heart and what was mentioned several times today, cancer in children. You know, fortunately, cancer in children is relatively rare, but if a family is hit by cancer for a child, this is horrible. And that's why we need to act. And we can only act due to the low figures if we cooperate. Good research, good clinical trials, good specialized treatment is only possible when we do it cross-border. That's why Europe needs to act. Second point, cancer patients and COVID-19. Cancer patients are 3 times. We heard that isolation, of course, is a problem for them. Like for most of us, we cannot meet friends and neighbors, but for these patients, and that's the second point, it's even more dangerous because they are under the risk persons. But the third point that I would like to add, unfortunately, we have a horrible second wave. Look at what is happening in Portugal now. And there is already, it has been in the last months and weeks, unfortunately, many treatments of cancer patients has to be postponed because the capacity of hospitals is overwhelmed by COVID-19. That's why, by avoiding risky contacts, by doing this video conference and not meeting in a room, by not going to a restaurant and avoid risky contacts in all our daily life, we help the cancer patients 3 times. We help the medical system not to be overloaded. We help to bring figures down so that the risk is less for cancer patients. And also we help them to go back to a more normal life when figures are down. That's what we have to do. That's why the policy to mitigate the COVID-19 pandemic is in the interest of cancer patients. And last point, the future and the science. I was quite impressed by what I heard from CureVac and what we also heard from BioNTech in our last conference. I know that we have a lot of polemic against the European Union, and when the time is right, we can look at what could even be done better. But, you know, it is due to the European support that CureVac, Mariya Gabriel mentioned it, that BioNTech could develop the vaccine. And we need to continue this cooperation so that they can also contribute to really fight cancer also with this new mRNA technology. I think it is not the only technology that can help, but it's a good example that European cooperation, European investment in science and technology can solve problems, and we need to continue this way. Thank you very much.
And thank you to Dr. Liz for your concluding remarks.
And with this very interesting intervention, we have come to the end of the EPP United Against Cancer event. Let me finish by thanking all panelists, commissioners, the people at home and our staff for today's event. And of course, thank you, Jennifer, for joining us today.
And you, Cindy, for marshalling your fellow parliamentarians' questions. Keep following the EPP Group on health-related issues via hashtag EPP4Health or on cancer via hashtag EU Can Beat Cancer, and of course via the EPP Group accounts on Facebook, Instagram, Twitter and YouTube. From all of us here in the European Parliament, thank you for watching and goodbye for now, and stay safe.